First it runs down and then runs up. Clear? So this from here to here it is the epididymis. These are different ductules. This is retate testis. These are seminiferous ductules. Clear?
Clear.
This is vas deferens. So I did not go into again the epididymis and all. I explained it all together. Okay? Okay? See here? So blood supply, as I already know it, it's just like the ovaries, which you already studied.
Yes.
They are testicular arteries, or you can say consider together you can call the gonadal vessels. Both for the ovary and the testis. They are branches from abdominal aorta. The right gonadal vein drains into inferior vena cava. The left gonadal vein drains into renal vein, left renal vein. So that you can remember like this: ovary and the testis. It is the same. Okay? And coming to the venous drainage here before the testicular vein formation. So it forms plexus, as I explained, around the vas deferens within the spermatic cord. That plexus we call it as pampiniform plexus of veins.
Yes.
Okay. So later all these plexus veins they form single vein, that is the testicular vein. Clear?
Clear.
Yeah. So now what is that? The lymphatic drainage. So lymphatic drainage, lymph from the testis is drained to lumbar and para-aortic lymph nodes. Very important, as the testicular tumors are common. Okay. So whenever you find mass in the abdomen, what? Mass in the abdomen, your examination is not complete unless you examine the external genitalia. You should never miss the examination of the external genitalia whenever you are examining a patient with mass in the abdomen.
Okay.
Similarly, mass in the necks also, it is not complete until you finish the examination of the abdomen, because cancers of the stomach especially, they what is the tortoise signs, what is explained. Okay, we'll go to supraclavicular lymph. Is it clear?
Yes.
So where is the lymphatic drainage of the testis?
Lumbar.
And para-aortic lymph nodes. So now the ductus deferens or the vas deferens. Okay. So it comes from the epididymis, runs through the spermatic cord, enters the superficial inguinal ring, runs in the inguinal canal, comes out of the deep inguinal ring. Are you following?
Yes, yes.
And then runs along the lateral wall of the pelvis, lateral wall of the pelvis, and then up to the ischial tuberosity it runs. Up to the ischial tuberosity. And then turns medially. Are you following?
Yes.
Okay, then turns medially anterior to your ureters, which are coming from the kidney.
Yes.
And then goes behind the bladder. Goes behind the urinary bladder, posterior to the urinary bladder, then runs downwards.
Yes.
Or inferior medial to the urinary bladder, you can say. Okay. So at that area, posterior to your bladder, see here, this is the urinary bladder. It is joined by one more duct ducts of your seminal vesicle. See, this is the, what is that? Vas deferens. And these are the seminal vesicles which are situated posterior to the urinary bladder. See here, this is the urinary bladder. Okay, these are the seminal vesicles. This is the vas deferens. Are you following? I will show you in the lab, don't worry. Afternoon you have a lab. Okay?
Yes, yes.
So then, this vas deferens is joined by seminal vesicle, duct of the seminal vesicle. So this is the vas deferens. Okay. Then seminal vesicle duct joins here. Okay. So now vas deferens, seminal vesicle duct. Then this duct, which runs distal to it, this is called as ejaculatory duct.
Okay.
What is called as ejaculatory duct. Both from the right side as well as left side. They pierce. This is the gland. What we call it as the prostate gland. Okay. Pierce the prostate gland. This is the ejaculatory duct and opens into the urethra. Am I clear?
Yes.
You can understand this now. See here, going up. So here it enters into the pelvis, lateral wall of the pelvis, running, and then goes medially behind the urinary bladder, joins the duct of seminal vesicle, forming the ejaculatory duct, which pierces the prostatic gland and enters into the prostatic part of the urethra. This is the urinary bladder. Beginning of the urethra, which is present, first beginning part, it is present within the prostatic gland. That's what is called as prostatic urethra. Then you have the bulbar part of the urethra, then spongy part of the urethra. Yeah. Am I clear?
Yeah.
So this is about the what is that? The vas deferens, and then later forming as the ejaculatory duct. Yes.
Does difference is complete with the urethra or spleen?
I didn't get you. What?
Does difference complete with the urethra or no? Will take urethra or no?
It will drain. So if you consider this as urethra, ejaculatory duct will come and open into urethra. Okay? Opens like one pipe is going and the other pipe coming and joining, so that all the secretions, the sperm, semen, everything, so that is drained into urethra. That's why it is a common pathway.
Seminal physical storage.
No, seminal vesicle is a gland. I will explain that. It is a gland. As I explained already, it is an accessory gland, accessory reproductive organ or the gland, which will cease when there is ejaculation. Semen, the quantity of the ejaculated is around 3 to 5 ml. 3 to 5 ml. The testis produces only the sperms, which are microscopic. What are the other contents of the semen? Like fructose, it is all added, right? The semen is mainly by these seminal secretions from the seminal vesicle and from the prostate gland. The semen is, which are nutritious and then protective to these sperms within the semen.
Yes.
All these secretions are from seminal vesicle and prostatic gland. Am I clear?
Yes.
Okay, this is the seminal vesicle, which is situated posterior to the bladder. These are the vas deferens coming. Okay?
So, Doctor, the sperms its synthesis in the spiniferas duct, not in seminal vesicles.
No. They will not go to seminal vesicle. Seminal vesicle is a gland. It's a gland which will add up mainly the fructose and all to the semen.
Yes.
They are not related to sperms. Sperms are produced in seminiferous tubules, okay, which are carried by vas deferens. So now coming to the last part, very important, that is the prostate gland. Why it is important? Because of clinical importance.
Cancer.
Clinical importance, not cancer. As you become old, as your hairs become grey, the prostate goes for enlargement. The people who live little longer, maybe around 70 years of their age, they will have problems. You go and ask any person who is crossed 70 years, he will tell his urinary problems. He will get up in the nights 3 or 4 times, go for urination, there is toilet, okay, and he will explain that he will have pain during micturition, dysuria, all those complications will have, because usually the old people's prostate goes for enlargement. That is called as a benign hypertrophy of prostate. What is that called? The condition called as BHP. BHP, that is benign hypertrophy of the prostate. Okay, which will compress on the urethra, giving rise to these symptoms. Okay, so the prostate is an unpaired, very important here. It is unpaired, it is only one gland. Like seminal vesicle, it is paired, right and left, whereas prostate is only one, okay, which is absent in females. Prostate is the gland which is present only in males, it is absent in females. They are lucky, you can consider. So, the prostate is an unpaired accessory structure of the male reproductive system, okay, and that surrounds the urethra in the pelvic cavity. It lies immediately. This is the bladder. This is the pelvic floor. The levator muscle. This is the urinary bladder. Between the urinary bladder and the pelvic floor, you have the prostate. Upper side, it is cone shaped. Can you observe? It is a cone shaped, having a base towards the bladder and then apex towards the pelvic floor. So this is the bladder. Okay, this is the pelvic floor. Between them, you have the prostate. You can say fit between the bladder and the pelvic floor. Okay, it is cone shaped like this, having a base which is towards the bladder and apex towards the pelvic floor, formed by the levator muscle. It's a cone shape. Okay, the center of which you have the passage of the urethra from the urinary bladder. See here, this is the urinary bladder, or you can say the neck of the bladder. Neck of the bladder. You have the passage of the urethra, which comes into the prostate and then coming up. This is the bulb of the penis. Bulb of the penis. Okay? And this is the prostatic urethra. And this is the ejaculatory duct. Ejaculatory duct piercing the prostate gland and opening into the urethra. Clear?
Yes.
Did you understand this picture? when the pelvis is cut like this to expose the bladder as well as the prostate and then all the pelvic floor and all. Clear?
Ejaculatory duct is it 2 or 1?
Two.
Two.
Right side and left side. Right testis, left testis.
You say the prostate produce semen.
Yeah.
The other
Prostate
side,
and seminal vesicle. Yeah.
let's say prostate on the right side.
Arey, yeah, it is added here. It is added, directly added in the urethra. Seminal vesicle secretion will come through ejaculatory duct. Whereas prostatic secretions, they directly open into the urethra. Prostatic secretions are added direct. Urethra is only one. Okay? So prostatic secretions is added into the urethra. Whereas seminal vesicle secretions are added to the ejaculatory ducts. Two ducts coming and opening into the urethra, one urethra. Do you understand?
Yes, yes.
Yeah.
What's the difference between secretion of smell and
So that you will learn in histology, man, histology of physiology. Nothing much is explained in anatomy textbooks. So it depends on the contents.
Well, why there is no relation between the blood relation and the secretion?
Why there is?
No interrelation.
No?
No mix between the.
Interfere.
See, that's why I said these secretions are produced only when there is stimulation, when
Yes.
there is erection. Then only they are added. These are all muscular tubes. These are all muscular tubes. They are contracted and releasing the secretions only during erection and further acts. Not in that case, this urinary sphincter is closed, preventing the flow of urine. Did you understand? This is an autonomic process. It is an autonomic nervous system process. They will have many sphincters. Okay? So they will be contracted during. Yeah, finish. Fine. Okay, got it? So that is about the prostate. Okay? So prostate, if you should look into the anatomy of the prostate, it is divided into different lobes. Okay, as it is a conical structure, the center we have the passage of the, what is that? The urethra and the vas deferens or the ejaculatory duct. So it divides the substance of the prostate gland into lobes. What are those lobes? Two lateral lobes, one middle lobe and one anterior and one posterior lobe. Totally how many? Two, one. 5 lobes. You have 5 lobes. 2 lateral lobes, one anterior, one posterior and one middle. So out of these, this middle lobe is important clinically because usually this is the lobe which goes for BHP, causing compression on the urethra, giving rise to complications like dysuria and nocturia. What is nocturia? So these are few slides explaining the relation. You can easily understand this.
You can take them in the lab.
Yeah. Yes? So that's all about the blood supply is by mainly the vesical arteries which are supplying the urinary bladder, which is supplying the. So as I said, the middle lobe which goes for BHP. Clear. Thank you.